This educational video is about functional neurological disorders. I recently received this diagnosis. Today, I have an appointment with the neurologist to learn more about this condition. What is a functional neurological disorder?
Functional neurological disorders, FND, is a condition where people experience problems with movement, speech, vision, or hearing. These issues arise due to disrupted communications between the brain and the body, but fortunately there is no damage to the brain or the nervous system. Symptoms of FND can profoundly impact daily living, making it challenging to perform normal activities. Functional neurological disorders is the second most common condition treated at the neurology outpatient clinic following headaches. This condition occurs at all ages, young and old, and is also common in people who already have another disease.
And what are the symptoms of FND?
People with FND can experience various symptoms. Some people may experience one symptom, other people may experience a combination of symptoms. Possible symptoms include paralysis, gait abnormalities, tremors or shocks, sensory disturbances, speech problems, swallowing problems, memory complaints, dizziness, or fainting. The latter is now called functional non-epileptic attacks. Moreover, people with FND can also experience fatigue and pain. Also, mood symptoms such as sadness or anxiety can occur. When this is the case, it often is important for the treatment choices. FND symptoms can suddenly arise and disappear, but they can also persist, and symptoms can vary in severity over time.
And how does FND develop?
Like many other neurological disorders, we do not exactly know why FND arises. FND involves disrupted communication between parts of the brain and the body. The brain and nerve pathways are structurally intact, but the brain's signaling network doesn't work properly. Sometimes there are too many signals, sometimes there are too few signals that reach their destination.
What factors can play a role in the development of FND?
We have to look at different things. Firstly, we look at risk factors. Certain situations can make someone more susceptible to developing FND. This could be having a chronic condition, experiencing a lot of stress, having conditions such as autism or an intellectual disability, but often there is no clear risk factor that can be identified. However, with functional attacks, there's often a relationship with stressful situations. Secondly, we look at triggers. These are events that precede the onset of symptoms. This can vary from an operation to falling down the stairs or a period of being sick. It's important to know that we often cannot find a clear trigger. Thirdly, there are sustaining factors. These are factors that prevent the symptoms from disappearing or getting better. Think of chronic pain, fear of moving, or improper coping of the symptoms. These can all cause FND symptoms to persist.
And how is FND diagnosed, doctor?
To determine if someone has FND, a doctor listens to the patient's story and conducts a physical examination. It's important to look for typical features of FND, also called positive symptoms, because FND can sometimes look like other neurological disorders. An example of a positive symptom in someone with FND who has tremors is that the neurologist can sometimes temporarily stop the trembling by having the patient perform certain tasks.
And how is FND treated?
Some people with FND recover spontaneously. They do not require treatment. But for recovery of other patients, it's very important that the patient understands what the diagnosis entails. If you have any questions about the diagnosis after it's been made, it's important to discuss this with your neurologist. A clear diagnosis and good explanation can often already help reduce the symptoms. If this is not sufficient, referral to a therapist with experience in treating FND can be useful. There are various treatment options, such as targeted physical therapy for walking disorders or paralysis, and for other forms of FND, such as functional attacks or memory complaints, a specialized psychologist can help. It is important that the therapist has experience with FND, as the treatment is often different from other neurological conditions. If this treatment is not sufficient, multidisciplinary treatment can be considered. This involves, for example, physiotherapists, rehabilitation doctors, and psychologists working together with the neurologist to provide the best possible treatment.
I have no further questions. Thank you for the explanation, doctor.
This was our educational video on FND. Today we looked at symptoms, causes, and treatment options for this complex condition. Thank you for your time and attention.